Do you wake up every day with a stuffed nose, runny nose, sneezing, or irritation that never seems to go away even after medications? You're not alone. Chronic rhinitis affects millions of people worldwide. It can interfere with sleep, work, relationships, and overall quality of life. But today you'll finally understand what rhinitis really is, what causes it, the real difference between allergic and non-allergic forms, and all available treatments from medications to lifestyle changes to the latest cutting-edge research, including a device that's been shown in randomized trials to outperform a sham procedure in reducing symptoms. What is chronic rhinitis and its causes, types, treatment, and new hope? Stick around, this could change how you manage your symptoms forever. And make sure you watch until the end for simple steps you can do today to improve your symptoms. What is rhinitis? First, let's break it down. Rhinitis means inflammation of the nasal mucosa, the lining inside your nose. When that lining gets irritated or overwhelmed, it reacts, and that leads to the symptoms most people know all too well: runny nose, nasal congestion, sneezing, itchy nose, or throat post-nasal drip. These symptoms can be intermittent or persistent and chronic, lasting for months or years. Medically, chronic rhinitis is often defined when symptoms persist for at least 6 months and significantly impact life. Despite usual treatment efforts, the reason we get these symptoms has a lot to do with how your immune system and nervous system respond to triggers, which we'll unpack next. Rhinitis, especially allergic rhinitis, is one of the most common health conditions in the world. In some countries, up to 30% of adults and 40% of children experience allergic rhinitis symptoms. But chronic non-allergic forms are also extremely common and often underdiagnosed because people think it's just allergies or a cold that never goes away. Allergic rhinitis, the best known type, is allergic rhinitis, what most people call hay fever. This is the type triggered by allergens like pollen, dust mites, animal dander, or mold. Symptoms typically include itchy, watery eyes, sneezing fits, clear, watery nasal discharge, congestion, or stuffy nose. Allergic rhinitis often follows a pattern. Symptoms worsen in certain seasons like spring or fall, or around certain exposures. Pathophysiology: allergens trigger your immune system to release chemicals like histamine, which increase blood flow and secretions in the nasal lining, causing inflammation and the symptoms you feel. Non-allergic rhinitis, but not all rhinitis is caused by allergies. In non-allergic rhinitis, symptoms occur without an allergic trigger. The immune system isn't reacting to pollen. Instead, other factors like changes in temperature, strong odors, smoke, or pollution, certain medications, hormonal changes, infections, nerve dysregulation, vasomotor instability. This type often affects older adults and can be just as disruptive, but it doesn't show up on allergy tests. Mixed rhinitis: many people actually have mixed rhinitis, meaning features of both allergic and non-allergic forms together. This overlap is especially common in individuals with chronic symptoms that don't fully respond to standard allergy treatments. Accurate diagnosis is key because treatments differ depending on the underlying causes. Why rhinitis happens? So what really causes rhinitis? The answer differs depending on type, but generally, symptoms arise when the normal regulation of the nasal immune response and nervous system gets out of balance. Allergic mechanisms: in allergic rhinitis, inhaled allergens trigger an immune cascade. Immune cells produce IgE antibodies which bind to receptors on mast cells. When allergens cross-link IgE, mast cells release histamine and other inflammatory chemicals, leading to swelling, itching, and mucus secretion. Non-allergic mechanisms: in non-allergic rhinitis, allergens aren't the problem, nerve and blood vessel responsiveness is. The autonomic nervous system, which controls blood vessel tone and secretions in the nose, becomes overly reactive. Factors like environmental triggers, irritants, and chronic inflammation can tip these nerves into a hypersensitive state. Chronic inflammation and nerve dysregulation: one of the reasons rhinitis sticks around and becomes chronic is that the nerve pathways in the nose become sensitized. This is where new research is focusing, including therapies that target the posterior nasal nerve to calm that overactivity. Symptoms in detail: symptoms of rhinitis can vary widely from person to person, but here are the most common. Rhinorrhea, nasal discharge, nasal congestion, stuffy or blocked nose, sneezing, sometimes in bouts, itchy nose, throat, eyes, post-nasal drip, mucus falling into the throat, cough, often due to post-nasal drip, fatigue, and sleep disruption from blocked breathing. In chronic forms, these symptoms are present most days, not just occasional seasonal flares. If you suspect rhinitis, a good clinical evaluation is essential. Diagnosis typically includes medical history, symptom pattern, triggers, physical exam, nasal passages, turbinate size. Allergy testing. Skin tests or specific IgE blood tests, imaging only if needed, usually not required for uncomplicated rhinitis. Conventional medical treatments. Once diagnosed, treatment depends on type and severity. Avoidance and environmental control. For allergic rhinitis, reduce allergen exposure, light covers, air purifier, keep indoor air clean. Wash bedding frequently. Medications are the backbone of treatment. Intranasal corticosteroids examples include fluticasone, budesonide, mometasone. Reduce inflammation and are effective for moderate to severe cases. Antihistamines. Oral second-generation antihistamines E, cetirizine, loratadine. Intranasal antihistamines E.G azelastine. Combination sprays. Antihistamine plus steroid formulations can be highly effective. Decongestants. Short-term relief but not recommended long-term due to rebound congestion. Non-medication strategies. Saline nasal rinses and irrigation can reduce mucus and improve symptoms. Some find relief from breathing exercises, acupuncture, or lifestyle changes, but evidence varies. What if medications don't work? Many people don't get full relief with medications alone, especially in chronic non-allergic rhinitis. For decades, ENT specialists have offered more invasive options like nerve resection, Vidian neurectomy. These procedures work but can have side effects and recovery periods. New research. Posterior nasal nerve radiofrequency ablation. Now let's talk about a major development in chronic rhinitis care, a minimally invasive device-based therapy that has been rigorously studied and shown to significantly improve symptoms compared to a sham procedure, the Neuromark system. How it works. The procedure targets the posterior nasal nerve, a nerve that carries parasympathetic and sensory signals involved in nasal secretions and congestion. Controlled radiofrequency energy is applied to the PN region, reducing hyperactive signaling that drives symptoms. In a multi-center randomized controlled trial, patients with chronic rhinitis were randomized to receive active posterior nasal nerve ablation or a sham control where no radiofrequency energy was delivered. The results were striking. Responder rate was significantly higher in the active group, 73.3% versus 35.0% at 90 days. Symptom scores improved significantly more in active treatment. Improvements included congestion, rhinorrhea, post-nasal drip, and cough. Why this matters. Unlike medications that mask symptoms, this targets a driver of chronic inflammation and nerve signaling. And importantly, safety profiles in these trials were excellent with very few adverse events. Long-term and real-world results. Follow-up studies and long-term data show that benefits can be durable for years, with sustained symptom improvement and quality of life gains. One study even showed continued benefits out to 2 years and beyond. Other emerging treatments. Beyond radiofrequency, researchers are studying other minimally invasive approaches such as targeted cryotherapy, laser ablation, and biologics for specific forms of allergic rhinitis. Systematic reviews suggest that nerve-targeted procedures often outperform older modalities in reducing symptom scores and improving quality of life. Prevention and daily management. Even with advanced therapies, prevention and daily care remain crucial. Avoid triggers. Irritant. Keep indoor air clean and humidified. Use saline irrigation daily. Follow medication plans consistently. Monitor for sinus infections or complications. Consider allergy immunotherapy for allergic rhinitis. When to see a specialist. You should see an ENT or allergy specialist if symptoms persist despite. Optimal medical care. Quality of life is significantly impacted. You suspect sinus complications or frequent infections. You're interested in advanced therapies like nerve ablation. Chronic rhinitis can feel endless, but there are scientifically proven ways to manage it, from medications to lifestyle changes and now device-based therapies backed by randomized trials that reduce symptoms more than placebo. If you learned something new today, like this video, and subscribe for more evidence-based health content. Drop a comment. What symptom affects you the most? And remember, relief is possible.